if I feel fine. My friend says she has, RBF.
I think I have that.
She's over on the back row. That's hilarious. She's slumming today. Yeah. And she got it on the side. Is that what we always do the fancy shit? She's a trip. She don't know America's got no. She don't want to have no money. I was that's a good trick. What's it?
Glad to have you here this morning. It is the first day of March. I'm blessed to see the sun rise this morning, and we have several things to discuss today and some guests. I would ask you to join me in the Pledge of Allegiance. Let us pledge. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all. Thank you all very, very much. Dr. Crystal Miller with Wedco District Health Department is here with us this morning, and we appreciate your time to come and just give us an update on Wedco and also our syringe exchange program that we work with you all on. So very much appreciate your time, what you do for the community, and we know that your focus is public health and trying to serve our communities, and we appreciate that very much.
Yeah, so I know that I'm here for syringe service program, but I've recently shared a presentation at our local level where Dwayne was there and Jared was there, and they thought it would be good just to, it's really interesting, but prior to COVID and the pandemic, people thought all we did were flu shots or restaurant inspections, and now we've swung it to where people still think all we do is COVID. And so I'm really trying to, in every space that I can, share that we do a lot more than that. And so that's what this presentation is about. Just giving you an overview of all the things that we do, just high level, some of the services, and so really just to do a refresher. Do you want me to control slides, or?
Zach is in there. If you'll just say next slide, and Zach will take care of us.
Okay, thank you, Zach. So our mission is to be a voice, partner, and leader in building stronger, healthier communities. So everything we do focuses is facing forward toward that mission. All right, next, Zach. So our departments are broken down into clinical services, environmental services, community health promotion, preparedness, and then obviously we have an administrative team that helps on the back end. So our largest clinical service is WIC, but we do a host of all of these things and more, but these are our largest programs, WIC being the very largest, which is a nutrition program for women, infant, and children. So from peer breastfeeding, helping new moms with breastfeeding and all the benefits to that, we have a nurse practitioner who does physicals, well child, schools, sports, and she's even trained to do CDLs, which is very unique to most health departments aren't in that. So we do lots of STI checks and testing, so that's sexually transmitted infections. If you're raised around the time I was, it's the same as STDs, so those are one and the same. We do lots of immunizations, adult and children, newborn screenings, emergency contraceptive, pregnancy test, fluoride monitoring in the schools with young children, lead testing, TB, lots of communicable disease, obviously hepatitis C, which is part of our syringe service program, and then COVID testing. We offer same-day scheduling. One of the things that has been beneficial to our community is that you can call on the same day and get an appointment. Kentucky has high rates of radon, so we have radon test kits available for people to pick up. Our clinic staff are notary public, so that's very helpful. We help WIC participants get on with voter registration. That was a bill passed, I think, with President Clinton during his administration. We also have one of the newest things that we have that's really helpful for our community is we have a community health worker. And one of the things that we found with change in MCOs and insurance is that there's a big gap for people. Lots of people need help signing up for and insurance and reducing barriers like finding a job or finding a place to live. And so we hired a community health worker that essentially works with anyone, our schools, an individual, to reduce barriers and help them in the ways that they need to be productive citizens. So, next. Not that this is not an exhaustive list of the vaccines that we do, but most people are curious about how much flu and COVID vaccines we're still doing. So just from September 2023 to January, we have done over 500 flu vaccines and over 400 or around 470 COVID vaccines. So people are still very much interested in vaccines, although Kentucky has very low rates of vaccine rates. We do lots of, like I said, STI treatments. We've treated 72 people for sexually transmitted infections. We have enrolled, as I told you, WIC is our largest program, over 1,500 people in WIC. And then TB is live and well in our community. So we have had 26 cases of TB, and that requires us to case manage, do observation therapy, direct observation therapy on them. So that obviously that ebbs and flows, but this last year we had 26 cases, which is pretty high for us. And then private pay and vaccines for children, we administered over 2,000. You can skip that slide. That's just the purpose of. Okay, so lots of people think in environmental, if you've had a septic system or you've eaten in a restaurant, most people know that. But this is just a cute slide on if you've ever stayed in a hotel, ate in a restaurant, lived in a mobile home park, went to a public swimming pool, went to an overnight camp, been bitten by a dog, built a house outside of the city limits, got a tattoo, laid in the tanning bed, went camping or went grocery shopping, our services have been provided. So we inspect and regulate lots of this. So our environmentalists have done, they do over 900 inspections each year. This is a breakdown of all the places that we inspect. Most of our environmental inspections are regulated and mandated by the legislature. And it's just as important to talk about what we don't regulate, because we get, as you all know, and Judge and I have talked about this, the number of calls and time that we spend helping people navigate problems that we actually have nothing to do with. One of the things that we're working, a project we're working on now with code enforcement is kind of a one-sheeter on where to go for certain things, because our team spends a ton of time, and I know other agencies in the community do as well, but these are the things that we don't regulate, but the community doesn't know that, and so we need to do a better job at helping the community understand where they go when they need help with specific things. So, next. We do private water testing, and we do environmental lead testing for children with elevated blood levels. This is, I don't know why that, I don't know why that.
Can I ask you a quick question?
Yeah.
On the private water, what are you looking for? I mean, why would you get that phone call?
Yeah, so lots of times if a child is sick, so an example, somebody gets sick in a daycare, and then we're trying to trace it back to, it can be city level, it can be, do you have, is it something that's going on in your home? So for those reasons.
I got you. Thank you.
Yeah. And this slide, those buckets are supposed to tell you what we've done in on-site, and I think you can, it's vague. I don't know if you all can see that, but we've done, this year, we've done 286 site evaluations, and I'm sorry, I don't know why that's like that. And we put in 164 new septic systems.
170 permits written.
And 100, there you go, you can see that. Look at those eyes, look at those young eyes.
Dr. Miller, I get calls about this every once in a while. So with septic and the land perks, you do have someone I think is certified, and do they have certain days that they're here in Scott County, or it's just kind of as needed basis on who gets calls and that type of thing?
So we're open every day here.
Yeah.
One of the things that I think you're maybe alluding to is we had 2 new staff members, and it takes a while to get them certified.
Right.
And so we were balancing that for a while, but now we have 3 full-time team members over here that
So
actually
they
do
can
that
call
work.
and get it set up.
They can call and get that set up.
So are you
yeah.
saying Gene did a lot?
Gene retired, and then he came back, and we still fill him in there every now and then. But he loves preparedness and acronyms. If you've spent any time with Gene, he loves. He can make an acronym out of anything. We do lots of rabies work. So we've 156 quarantines. We've tested 27 animals. So that requires us to cut off the head of an animal and keep it temperature controlled and send it to the state. One of the things that we did prior to COVID that we've just restarted is rabies clinics. So we partner up with vets and offer a rabies clinic for animals to get vaccinated. So that's just a service, and we've vaccinated over 140 animals. So these are all of our programs, and I won't go through each one of them. We do
Dr. Miller?
Yeah.
Who pays the actual fee for that rabies vaccination at those clinics?
So,
does the owner?
Sometimes, so it's usually a partnership between the vet. They'll just give us that at their cost. Sometimes we have funding at the state level that we can help with that at a reduced cost. So it really just depends kind of the landscape that we're in.
And the reason I ask is we've had discussion about rising vet costs as a reality for our animal care and control, and that was just a
Yes.
Would a lot of those be, not, stray issues, stray dogs?
So those clinics are for anybody. We advertise them for anybody to bring their animals in.
Oh, okay, they're
so.
bringing it. Okay.
Yeah, and we are also facing lots of different situations in our communities with stray animals, what to do with them, how to quarantine them. It is a major issue, and we're seeing that on our end too. But usually that's for people, just because it's organized in that way. Not saying that we couldn't do that. Be a little more creative about how to address the stray issue. It would be capturing them, and that goes along with that. So we do lots of health education. Like I said, I talked about our community health worker a little bit, so people that need help navigating social services. And then we have HANDS, which is a home visiting program for new first and second time moms and dads. And then obviously accreditation, that's just, we're accredited. We're going up for reaccreditation this next year. So next. So this is a specific program that we're really proud of. It's unique to us. Not very many health departments, if any, are in it. But it is, we call it the Beautiful Minds Program. It's a suicide prevention program, mental health. There's lots of data to go along with this, but I just wanted to share with you. We had, I want to bring attention to, it's a collaboration between WEDCO, Scott County Schools, and UK. And this started from seeing an increase in suicide in school-aged children. And it started in Lincoln County, and we got wind of it and wanted to partner up. So one of the things that I want to bring your attention to, though, is the active consent piece. So that is, prior to SB 150, you could have active consent or passive consent. And active consent requires a parent to actually sign something for you to be able to administer something. Passive consent is if you don't send it back, right? There's now legislation that has stopped that, but that's a big concern for us for many reasons. We're not touching the students that we need to touch through active consent for a host of reasons. But so I say all of that to say it's a small group of children just because of that, the active consent form. And Dwayne, I know you know all about that being in the schools. But in fiscal year 22, we had of the kids that we administered assessments to, 2 were at risk of suicide, either high or medium risk, and 4 in FY23. We had 136 in FY22 get medical treatment, so those are individuals that are receiving some type of medical treatment from an APRN or higher. 92 in fiscal year 23, and then if you look at the behavioral visits, these are multiple visits, so not individual students. We had 380 behavioral visits and 407. I didn't go into, because it's just a lot, but looking at the assessments that we have and the questions that are asked, when I compared FY23 and FY22 of the students that are assessed, we are really making headway on safety issues and really bringing awareness to drunk driving, texting while driving. There's legislation now that we can't ask specific questions about sex, so we're not allowed to do that, and I don't have that data, which is a whole other conversation. But just to share that we are doing work with students who really need mental health help and assistance. So this is not a mandated program. This is just something that we choose to do at WETCO. All right, so what I was really here to talk about, syringe service program. So the total number of visits that we've had this is 2023. Yes, I'm sorry.
I'm sorry, I apologize for interrupting. Just one more time, back to all the services. I don't know, Judge, if you know it or not, but I actually talked to Dr. Miller yesterday. I've had 2 constituents over this bluegrass water, and just so I can, because I told them I'd get an answer, and we've talked about they want to put their own septic system in, but I have basically told folks they would have to come through you and your office to see what they can do. Is that correct? I mean, yeah. So.
Yeah, for a septic, yeah. So he called me about the rate increases that people are experiencing in certain parts of the county, and so obviously when that happens, people start looking at what are my other options, and
That's right.
There are a couple things that that we would have to go through. Number one, it's an ordinance that if there is city sewer available, you have to tie on, right? And so they're tied on. And so we would be going against the ordinance, and that, not that there's not a case for that at some point in certain situations, but it would require them releasing each individual resident who would be interested in that. But really there's a couple of big factors: quality of dirt, size of the lot, and then obviously cost. And so I did some very rough estimates for a 3 to 4 bedroom home, anywhere from $20,000 to $30,000. If it's bad quality of dirt, then you've got to haul dirt in, you've got to wait a year. I mean, it's, people think that, I'll just get a septic, right? But it's just...
But all that work has to be done by a licensed installer.
Installers, that's correct.
And then you all coordinate with that licensed installer. Your staff inspects the process.
Yep.
So that's part of the whole.
Sure. Yep.
Well, thanks, Dr. Miller.
Yeah.
When we get the calls,
Sure.
we try to go to where we got to go. So I appreciate that information.
Yeah, call me anytime, and we'll try to help.
And I hope people know, and we've shared this, that we've advocated with the Public Service Commission and hired Strobo Barkley from Louisville to really address that, what we felt like was an exorbitant, not following the practice of gradualism rate increase. And we did that both for the Delaplane commercial area and then also the Moon Lake, the Longview, the Homestead, trying to advocate for our community. And we did have some success. Some rates that were $99 going to be reduced to $77. It's a very complicated issue. And then we've also petitioned the Public Service Commission on that rate case for essentially an explanation of why did you do what you did. I wouldn't call it an appeal, but we are asking for more information. Any comments from anyone there? I know that's kind of out of the lane, but it's kind of tied to why you're getting these calls.
Yeah, and like I said, if you need information or you need to send somebody to us, feel free to do that. We have 3 full-time staff members just specifically for environmental that can help answer some of those questions. So if they have more questions,
Sure.
Just give them our number.
Well, I appreciate the info. That's what they need. They were doing what you said. They
Yeah.
were just trying to look at their options.
That's right.
And I said, I don't know what they are, but I'll find out.
Yeah, and everything's expensive, right?
Yeah.
Everything. So syringe service program, which is why I was here scheduled to come to begin with. We've had in 2023 47 new participants. So referral services, we obviously we do that. I'll get into that on the next slide. About 53% are male and 47% are female that come through our program, and the average age is 40. Some of the things that are important to us is obviously trying to meet people where they are, educate them, help them understand what their resources are, reduce barriers to help them get back into work or have a house or a car, et cetera. So reducing overdoses, we've had 21 reported overdose reversals through, and that is a collaboration that we work through police. We've got an OD map system, and so that's reported through like EMS or police, so that's where that data comes from. And we provided 300 Narcan kits.
Dr. Miller, we have opioid settlement money, and the court has been very strategic about how to allocate those funds to try to make the most impact with folks that are struggling with this. And one of the initiatives that we have is we've allocated funds for 2 social workers at our secondary schools, and feel like that's very important. And then we've also allocated half the salary for a community paramedicine provider. Brandon Remley is in that role. As we move forward, is that something that you all can collaborate with Brandon with on? I know one of the big things is that your clients always want confidentiality, and it's very important, but being able to maybe connect with Brandon as well, and connect services that you might already be doing that.
We do. We work with EMS. We work with the Angel program. So we try to be anywhere and everywhere we can to kind of close the circle of wherever someone comes in, whoever can help gets them, right? And so, not that there's not a lot more work to do, because there is, but on the mental health side, on the substance abuse side, all of that. But that, as we all know, that's not an easy solution.
And then we also partner with the Isaiah House here in town as well. So.
Yep, and we refer out to all of those. So Jackie's House, Gathering Place Mission, do lots of work with every organization that's trying to. Amen House.
And one other partnership with the Net Device folks. I don't know if you're aware of what that is. I'll have to send you a link. You can watch the movie. But if that gets off the ground, if they go, because they will treat, was it 34 Scott County
34 individuals.
This device.
We're going to pay for up to 34 individuals to use this device, and it will be in a partnership with Isaiah House and the Net Recovery Corporation. And this device, we hope, and what's been shown, is that it reduces withdrawal symptoms and lets folks get to that stage in recovery where they can move forward faster, hopefully. And
So like
I think one of the things that people always share, that folks that are in active addiction that want to get out, they fear withdrawal so much that it keeps them from taking that step. The hope is that this device will lessen that and make it more of an option to try to take that step.
Okay, so some form of MAT.
It's a neuro pathway. It works.
I'd be interested if you just.
I'll send you a link.
Okay. Yeah,
and you can
thanks.
watch. They treated 5 Kentuckians. The Isaiah House over the past, what they say, dozen years has treated 400 to 500 people with this device.
Through this. Okay.
And it basically, most all of them report that it takes away the withdrawals in 20 minutes. And they use the device, what they say, 5 to 7 days. It depends on the individual and what they're on. That's another
Well, that would be
discussion, but-
interesting to link up when we have, so, people come into us in a variety of stages. Some of them are wanting to get out. Some of them, they're not there. But knowing that and being able to link up would be really effective.
What's unique about it, in my view, it's unique. I don't know that much about it, but what's unique about this device is it's even like not Narcan, but Suboxone, methadone, and some others that are legal drugs. They're just as addictive.
Right. That's right.
In fact, some of those clients that were treated that's in this movie, it takes them off of that too. But the unique thing I think about it is you have to actually be in active addiction. So somebody that's taking Suboxone every day is considered active addiction, and so that they can treat that, but they have to be. There's just a short window when they've used, and then they use this device. And anyhow, I'll send you a link.
Yeah, I'd be interested
You can
to.
see it in action.
Okay.
So
Yeah, thank you.
one other question,
Yep.
not about that, but about one of those statistics. Let me get my picture back up. That bottom statistic, which I think is
21.
interesting.
Overdose reversals?
Yeah, which is using the Narcan, I'm assuming. Are you tracking at it? Because this is great, getting all these stats. It helps us, all right? It helps me, but how do you track that? I mean, do you think that's Narcan that you guys have handed out, or it's just a general?
It could be a host of, because here's how we track that. We have a system called OD Map. So if EMS goes out to a call and they will report to that, and we can get that data. So that's where that's coming from. So it could be, you know, and I will say that number is low, because in handing out Narcan, the general public, like if I go out here and somebody's overdosing and I administer Narcan, that's not going to be reported, right?
Right.
And so that's the point in having Narcan, trying to get Narcan in the hands of people who are comfortable using it and being trained on it.
Because, as you know, and it's still a concern of mine, I've always been concerned about when you're giving out the needles through this, and I know what the program's all about, and I get that, but I'm still concerned about somebody dying with one of our needles, because that's what it becomes when we approved it. And so I didn't know if there's any way you are able to track anything like that, because I think that would be a good statistic. I don't know if you can do it or not, but I'm assuming privacy and other things. But
I mean, honestly, privacy makes this, it either makes or breaks this program, because as you know,
people won't show
look
up
through that lens, right?
Right.
But I feel like this data will help you get behind that even more, Rick, because I know you've struggled with getting behind this program. So you all remember, it was a very difficult push for those that were on the court to talk about this and get our heads around this. And this is not where anybody wants to be, but unfortunately this is where we are in life. So we do lots of things in our syringe service program. One of the big things that we do is HIV and hepatitis C testing and outreach. So everywhere we go, we ask people, do you want to be tested for hepatitis C or HIV? We've referred out 3 people to substance use treatment. HIV is still in our community, so people have forgotten about that as well. We've identified HIV positive people in our communities, and we've been able to refer 3 of them to HIV care. And so that's a cost, right? You can put dollars to that. Hepatitis C referrals, we've referred 119 people, but lots of that gets lost to follow-up at times due to just life in general. But we were able to follow 50 people of the 119. So that's still a really good return to be able to follow them and figure out, kind of where they are. And then we've had other referrals, like to if they have an STI or if there's something else that they need. So that's the other referrals.
On the hepatitis C, is there a cure for that now, or does that work for everybody?
So, yes, I'm going to talk about that. So,
okay.
If you look at this right here, my little box. So we sent our nurse practitioner to hepatitis C training, and so she actually does this. So we have 17 people to date across our district. So we have a syringe service program in Harrison and Scott. We do not have one in Nicholas. 17 people were treated. 16 of those completed the treatment. So I just want to do the math for you. So 94% of people have completed this treatment. If you remember when we talked about this in the very early days, treating hepatitis C late in the game is $100,000 roughly. To treat it at the onset is less than $20,000. Okay, so it's a cost savings to us. So if you just do the math, treating hepatitis C, so 17 times $20,000 is like $340,000. If you don't get them early and you have to treat them late, that's like $1.7 million. So we've saved taxpayers $1.3 million by being able to treat people for hepatitis C. And this is what we're after in syringe service program. We're not, obviously it's a political issue, but that's what we're after, is stopping the spread of disease, which is why the health department is concerned about it, because we manage communicable diseases. So I just wanted to put a number to that, and I hope that helps you, Rick. Because
I've always gotten it, and I will say this, Dr. Miller, it's not political to me. I just care about people, and I care about the dead ones as much as the live ones. These are awesome numbers. I'm tickled that these folks are getting help.
But we had to start this program to get the data, right? Like
yep.
So we're
right.
What, 2017? How many years is that?
But at the onset of this conversation, Dr. Miller, the Scott County, Indiana
Yeah.
was the
That's
situation that made my mind up that we had no alternative but to pursue
Yep.
this type of program, because I didn't want Scott County, Kentucky to be in that same situation that was a disaster.
Yep. Yep.
So
And you think about it, this is small numbers, right? 17 people, but we've saved $1.3 million because hepatitis C does so many other things not being treated. And so our nurse practitioner works hand in hand with these people and builds the relationship with them. So they come in, and if they're willing to go through that, then we link them up to clinical care with her. So we really try to make it a one-stop shop.
but those 17, 16 people are somebody's baby. Those 17, 16 people could recover.
Yeah.
Those 17, 16 people could become, clean and
Yep.
normal tax-paying citizens again.
Yep.
That's the hope.
Yep, that's the hope. So hopefully that's gives you a little. I know that it was super hard. It took 3 years, but I feel like we're doing really strong work in this area. So, all right, next, Zach. This is just pictures of us. Next, our preparedness program. You can go on. So we are responsible for being a community partner with any disaster, as you know, whether that's 9/11, whether that's the pandemic, H1N1, all the things. We have lots of partners, so obviously these are some of the preparedness sides of things, and then obviously anytime there's a local issue, we've got local elected officials, you guys, city commission, so those are our partners. And these are our plans. We are responsible for having plans, lots of plans, right? Lots of plans. We never want to see each other except for in places like this, because if we have to work together, it's an issue. There's something going on. And speaking of Gene, that's Gene's motto at the bottom. If you fail to plan, you plan to fail. So if you've hung around Gene, he loves to tell you that. You can go to the next one. And then our team, you can go to the next one, Zach. There you go. Our team, all of our team are trained on the top 3, which is basically how to respond. And then our management team is trained on all of these. So just really being ready to be a good partner whenever we face issues in our community. And the next, these are some grants that we've had. We've been able to help the school with lots of things, message boards, behavioral health. Anytime we get a grant, we're looking at how can we help someone in our community. So
along those lines, we've had much discussion about a messaging board in front of Garth Elementary, and it's been a conversation piece. Tourism, nonprofit events, could a messaging board at that location benefit WEDCO as well for advertising things that you all are doing as well? I know this is a baited question. And no, I'm not asking for your money.
So right. Well, first and foremost, if there's a funding mechanism for us to do that, we will do that. If not, we also have a message board that you can use at any time.
I'm
Are you
talking
saying
about
permanent?
I'm talking about a permanent.
Okay.
I've had,
So
and
we might have.
we've talked about
We
it.
might
This-
have some funding. That,
This is
Actually, I'm pulling the one she gave us, the
And listen,
auxiliary
it's
one.
fancy, isn't
We're
it?
putting it up at Garth right now, actually,
It's
for
better than the one
kindergarten
we-
registration.
Yeah.
So,
It's
but
fancy.
it's something I would like to
Okay.
try to get in our budget for this coming fiscal year, and
Okay.
it just with you bringing that up right there, I said, well, that's another community partner that could advertise, hey, we're having this clinic this weekend.
Let me look at our funding, and we may be able to help there. I'll shoot you an email.
As always, much appreciated.
All right. Next, Zach. I'm almost done, I promise. And then one of the things that we're doing internally is you should never call the health department and not have someone really being exhibiting high customer service. That's really important to me. We have a strong internal culture, and I always tell them impressions matter. And so just our North Star is internally and outwardly focusing. We want to be efficient, and we want to be good partners. So that's something that our administrative team is really doing some work on. Next, Zach, and this is just last one. We have we have about 40 staff members. You all may recall we sold our home health agency, cut our staff in about half. We should not be in the home health. That's not public health. So that was a great move. And then our budget is a little under $8 million.
Questions, comments?
Crystal, at one time, I assume that the main offices are still over in Harrison County and Cynthiana, and there was a discussion at one time about moving those to Scott County. Now, this is pretty
Way back, yeah.
pre Judge Covington. Is there any plans or any thoughts about that? And then the second thing, talk a little. You may want to speak a little bit, because when COVID was going on, me and you had a conversation about how, with Nicholas County and Harrison County and Scott, about how having all those counties together, it really helped during COVID, and to be able to serve a lot of needs that you probably couldn't have done if you were separate in just the Scott County
Correct.
Health Department. You don't have to elaborate on that too much, but
Yeah.
You could talk about both.
Sure.
of them.
So one of the things that we've done that you may not be aware of, so we no longer have an office in Harrison County. Our building in Harrison County was large enough, especially once we sold home health. So the administrative team is at that location. So they're at the Harrison County Health Department. So, but to your second point, I'm a big believer in shared resources, and being a district is just that. So one director for multiple counties, one manager that manages 3 counties, and we can move staff. So it was beneficial during COVID, because we could pull our entire team together and address whatever issue. So in Kentucky, there are 3 types of health departments: single county, district, which is what we are, and then large independent, which is Lexington, Louisville, Northern Kentucky. They're just a different animal. So being a single county, of course, you have lots of administrative costs, because you have someone doing payroll, you have someone doing HR, you have, you have a maintenance person, whatever, and we are able to share those costs. So I'm just a big cheerleader for that model, especially with rising costs and state pension and all the things.
Any other comments or questions?
He has that PowerPoint if you all want it, and if you go through it and you have any other questions, just yell at me.
Anyone?
Okay.
No, thanks so much.
Thank you.
Appreciate it.
So thank you all very much. Have a good weekend. Appreciate all you do. Keith Winstead is now with us, and he is going to introduce some guests that he has with us. Keith's with Thoroughbred Engineering. This is related to a Planning Commission request of Bierman property. And Keith, welcome. I'll let you introduce your guests, and then Cam was going to make a couple comments, then you can go forward.
Okay. Again, my name's Keith Winstead with Thoroughbred Engineering. We're here relating to a zone change request for the Bierman property located at 1925 Lexington Road, just this side of the Fayette County line. Mr. Bierman is here, the property owner, and his attorney, Mr. Younts. And Mr. Bierman wasn't available to speak at the Planning Commission meeting, so we wanted to take this opportunity to be heard at this time, and we appreciate the opportunity.
Thank you. Cam?
Yeah, that's fine, and welcome.
Thank you.
I was sort of consulted just to look at the procedural, like what's the appropriate procedures to follow. So there was a Planning Commission public hearing in which the requested zone change was denied.
Thank you.
So that recommendation now comes to the fiscal court for consideration for either approval or could overrule them. I think it's fine to hear from these folks today. I've spoken briefly with Mr. Kane as well, and I would ask that the comments be centered on matters that were addressed at the hearing. And so this isn't like, today is not like a second hearing or whatever, but it is an opportunity for them to address the court. And if you have questions about background or context or whatever, we can address those. Ultimately, I think procedurally the court can do one of two things, and obviously we're not voting on anything today. One would be, vote to uphold what the Planning Commission did. If you do that, that's fine. You can, if the court is inclined, though, to overturn what the Planning Commission did, then the zoning law appears that there has to be a public hearing first. So then I think what we'd have to do is if you guys are inclined to do that, or if at least some of you are, we'd have to provide notice and set a public hearing time. I assume that'd be, one of our regular fiscal court meetings. So anyway,
So
that's
if
just a
someone
little
was gonna-
procedural guidance.
So if someone was going to intend to make that motion, we'd need to notify and make a public hearing notice and then go from there.
And then I also emailed out the KRS that, you have to hang your hat on one of these things if you're going to overrule what the planning commission did. So
You gotta have supporting evidence on
Correct.
why you would overrule
Why
it.
it's
You have to state that in the motion.
within the plan, anyway, what
Yeah.
you said, Chad. So,
I saw Mr. Jones down there shaking his head.
Well,
You have just a little experience as well.
yeah, I don't know how much discussion I can have in this, because when this was first approved, I was the chairman on P&Z.
Gotcha.
So I don't know where I should fit in or not
I
on
think
this
today
whole
we
issue.
can all just listen. And
yeah, it's a work session today, but yeah, if you're not comfortable, if you need to recuse from the vote, that's fine.
I didn't know if I had to, or
I don't think have
since
to.
I was
but-
a-
We're not taking any action today, so if we need to discuss it further,
something
we
you can
do
look
that
into
after.
later. Okay.
Mr. Hostetler.
One other question on the timeline. So, I just looked at it, but I don't know where it was at. When did the planning commission, what's the window for this appeal?
So,
to-
so I was going to recognize Joe Kane, our
Okay.
director here. And
Well, then
Joe,
you-
would you like to comment to that as well?
90.
Is it 90 days?
He'll tell us momentarily.
Yeah, I believe the timeline is 90 days from planning commission action to, you have 90 days to make your final decision. I believe that the applicant can waive that 90 days if they're so inclined.
What do you mean?
Well, the applicant, since the 90 days is there to protect their interests, it's in KRS 100, but I believe there's an avenue for the applicant to say, we're willing to wait longer. You're not forced to make the decision in 90 days if the applicant agrees to waive the 90-day requirement.
That's it. Sorry to interrupt you, but it states in your letter, Joe, that says the fiscal court has 90 days from the date of the planning commission action to uphold or override the planning commission action, or the planning commission decision will be binding. And so that action date was January the 11th. When
Yeah,
the,
so, well, I just remember in my first or second year on court, there was a property owner that wanted to contest, but he didn't realize the timeline, and I believe that Judge Lesby at the time called a special call meeting just for that, because that timeline was running out. And I just didn't want that to happen to them or us,
Right.
to the property owner or the court to be, I just want to make sure we're in that
yeah,
window.
that's a good point. It seems like right now we're well within that, but yeah.
I believe it's January 11th was the hearing, so April 10th would be the 90 days.
Okay.
Yeah.
Joe, you have any other comment or?
I had no other comment. I don't want to get into kind of the record, but Planning Commission held the public hearing, made their decision based on the comprehensive plan guidance. So, they voted unanimously against it. I think it's well within the court's right to hold another hearing and make different conclusions, but
Of it specific, like, I was reading through, it says that they denied it because they did not satisfy KRS 100.213. Like, so what didn't they satisfy? Like, what is it based off of?
yeah, it's based on three things: whether it complies with the comprehensive plan, including the future land use map, and if it doesn't, whether there's been significant changes in the area, social, physical, economic, that were not considered in the last comp plan update. So since the last update, if there have been substantial changes in the area that would support a change in zoning of a particular property, or whether I guess the last one is just whether the existing zoning is inappropriate or incorrect, either an error, staff error, or just incorrect on the face of it.
Thank you, Joe. Keith, we'll let you all proceed.
Yeah. Has everyone had the opportunity to look through the record? We understand that it's existing zoning I-2 now, and it's an expansion of that by 2.28 acres. There has been an example of the comprehensive plan not being followed just up the road for the, is it Meade tractor? The John Deere tractor place. So there's been examples of the comprehensive plan not being followed previously. So if there's not any direct questions for me right now, I'd like to introduce Mr. Bierman to say a few words.
I have a quick question. You referenced the Meade tractor. Is that on a conditional use permit, or is that on that zone change?
That was a zone change.
Okay. All right. So I just wanted to be
And
sure.
that was-
that was done way before any of us were on court. But,
Not long before.
yeah, but
it
I
was.
didn't know if it was on a
But that,
CUP or not.
that was also Bevan property. That's
Yeah,
when
that's
he
correct.
moved, he built and moved, and now Meade rents, or I'm not
Yeah,
sure
yeah,
what
I'm
that,
not
I'm
sure
not sure what that,
exactly either, yeah.
but it was a zone change.
Okay. Thank you.
Mr. Bierman, good morning.
Morning. Morning. I appreciate you all giving me the opportunity to get up here and explain why we started innovative crushing and aggregate, and why we need more property. Back in 1950, our father started Merle Bierman Excavating. In the mid-'80s, me and my two brothers took over the business. We did a lot of work around Louisville, Kentucky, Clarksville, Indiana, and also here in Lexington and Georgetown. Seemed like when we come down here and do work, and much like Louisville, when we do a demolition job or a parking lot expansion, pull up asphalt and concrete, didn't have no place to dump it. Run in, you could dump in unapproved areas, but we didn't like doing that. So we come up in the mid-'90s, we come up with innovative crushing and aggregate, and basically what we do is we take people's concrete and asphalt and even some brick rubble, and we make it into usable material. Basically, we take the rubble and crush it into same material, same sizes as you would have at a quarry. We use it for the same things, from pipe work to parking lots, under buildings, dock areas. We use it for pretty much the same thing. In Louisville, we started it in the mid-'90s, and there was an issue around there where you couldn't get rid of material. The only place you could take it was a landfill. And landfills were, I know down here they're $70 to $100 a ton. You can bring it to our yard and get rid of a whole tractor load for $40. So we made it more economical to get rid of the material, plus we're recycling it and using it back. And the material works actually very well. And since then, in the last couple of years, we've been very thankful to have Louisville, our Louisville yard, because we've had two different areas close to the Louisville area and in Clarksville. The existing landfills have gotten full and closed up. So we've gotten very busy with the recycling. We bring the materials in, we turn it into a good usable material. And it keeps people from dumping in unapproved areas. We have a lot of different people come and bring materials to our yard. Plumbers, demolition companies, excavators, a lot of residential people, believe it or not. They'll clean up their backyard, and whether they bring it in the back of their truck, and we even have people bringing it in the trunk of their car. And we even had one little lady. She come in. She said, "Thank you for having this place so I could clean up my backyard." Is one of the things that we like about our business. We're very proud of our business. Also, our facility. We know it's not glamorous. It's not a horse park. It's not a strip mall, but cities need these places to keep all the areas clean, to keep people from dumping in, in ravines or farmland, we need a place to get rid of our material instead of taking it to the landfill. And so that was another reason why we started it. The property that we're talking about, the 2 acres, it's in behind the graveyard. Right now, we are stockpiling material out in front of our property, or in the front section of the property, I should say. What we're wanting to do is the 2 acres that's in behind the graveyard, we're wanting to use that area there for stockpiling. We're not going to be processing. We're just going to be basically parking dumpsters on it. We also have a dumpster service. Didn't mention within our business, if somebody doesn't have the means to bring the material to our yard, we'll set a dumpster out on their property. They can fill it up and bring it, and we take care of it that way. But we're mainly wanting this property in the back to stockpile material, to crushed material, the cleaned up crushed material. Right now we've got it out front. We're wanting to move it to the back. We're out of room. We're just basically out of room, and we're needing to build a shop to work on the trucks and the equipment. And we're wanting to put that out front. Of course, we're going to make it. We've hired Morton Buildings, which I don't know if you're all familiar with Morton Buildings. They build a very nice curb appealing building. That's what we're wanting to do out front, and we'll be moving all the material around the back so we can put this building out front, or at least on the front portion of the property. We've just run out of room. We have a big pile of concrete there to process and to turn into usable material, and we're just needing more space, and we just are looking for that. We've run into a couple different deals where we've had to turn people away because we've been full. Is another reason why we need the property, and that way we can get more material in our yard and get it processed and recycled. We hated to do that, but we're out of room. So and we feel like that cities need yards like ours to keep other places clean, for them to have a place to take their rubble instead of the landfills and filling them up. So we just ask you all to consider us in this deal, and we appreciate it. And I'll be glad to ask any questions or answer any questions.
Thank you for being here, and are there questions?
I got 2 or 3. So it's 2.28 acres.
Yes, sir.
That you're looking at.
Yes, sir.
If this is an if, obviously, if the court were to look at this, how long do you think that would? You're out of space now, basically,
yes,
right?
Yes, sir.
So, what would the 2.28 acres, as far as how long would that last you? You know what I'm saying? I don't know if you can.
I think I can't answer that. It seems like we have a lot of people come in and bring us a lot of material from. Every year we get more people wanting to bring more material in.
How long have you been at that location?
Since we started the permitting process, I think in 2011, and we actually got permitted in 2012.
But that property already had an industrial zoning of some sort, didn't it?
Yes, sir.
Yeah.
Yes, sir. Yeah. We actually owned the transformer building in front of it, and then we bought the 5 point something acres there in back along with that, and we've since split the property, sold the building, and just using the property in the back.
So the
yes,
buildings, you no longer own that building there? That I think
no.
I know where it's at.
Yeah, no, sir, we don't own it no more. No.
So the access would be the same, though?
Yes, sir. As far as everything in the front would stay the same, really nothing's going to change other than the fact that we're going to take the material that we are storing in the front area and we're going to move it to the back on this 2 acres, and we are going to put a building there where we store material now. and we're in the planning part of that. We've got all our site drawings and got everything pretty much approved, and we've actually already hired Morton Buildings to put the building up.
So, but that's gonna be towards the front of the property? Would that
Yeah.
be beside the old transformer building?
It's adjacent to it. If you're looking at the transformer building, there's a parking lot there next to it, and then there's a concrete driveway. That's our access, and then we have an area there on the right of that concrete drive is where we're going to put our building.
And all that property that you're talking about is currently I-2 or I-1?
Yes, sir.
Yeah. So, another question, if we were to do it, could that 2.28 acres, can that be seen from US 25? You know what I'm saying?
Well, it's in behind the graveyard.
At the back of the cemetery.
So yes, it can, but we proposed putting up a 10-foot fence around it. Something that looks decent. So,
Would you use the fence that you couldn't see through? Type of thing?
I believe it's going to be a wooden fence of some sort or a slatted fence. I believe it is. Yes.
That probably wouldn't let you see through it.
Yeah.
Any other questions? Thank you very much.
Thank you. Appreciate y'all.
With that said, if there's no other questions or comments there, I'm going to call on Assistant Chief Baker. Assistant Chief Baker has 3 items that we wanted to just kind of lay out, knowing that we can't vote on anything today, but just get general comment and go from there.
All right, so first thing would be the AFG grant, which is the Assistance to Firefighters grant. I actually applied for this last year and the year before, and I think that's fairly certain that's how we got our exhaust evacuation system in all of our stations, the magnet grip system.
About $170,000.
$170,000, yeah. This year we were looking somewhere. We're looking for fire hose. We want to replace the fire hose in all of our frontline engines and all of our backup engines. Some of that hose predates me. I mean, we're talking 20 years. The supply lines in the back of the truck, we currently carry a 4-inch large diameter supply line. We're wanting to upgrade that to 5-inch. Fact-based research looking at that, just by increasing by that 1 inch is going to allow us to push far more water a far longer distance than what we have with the 4-inch supply line. And looking at that, the total would be $322,728. That would be a federal contribution of $307,360, and then the county would be liable for $15,368. And that would be, with the court's approval, we would get on that fairly quickly. Is that and that's the same issue? It seems like we've talked about this hose issue for a while now. We're trying to get from the 4-inch to the 5-inch, right? Is it? We've never been able to get enough to make it happen, right? For reasons years ago, they got a deal on some 4-inch supply line. It was used or something, wasn't it? Yeah, it was used supply line, and we've used that for 20 years now since I've been in Scott County. Yeah. We tried last year to get the AFG grant. We didn't get it last year, but we'd like to try again. Gotcha.
So we approve the application, support the match. We'll do this via resolution on Friday. Timeline, do they share in the grant application that, hey, awards will be made in the fall of 24?
To be honest, I'm not for certain when they share, when they award it. With the magnet grip, I think it was fall that we were.
Our Honorable Treasurer, Michelle Ray.
Please.
Honestly, those AFG grants, it might be a year before we get it. And we just received funding from a fiscal year 21 AFG grant probably 2 months ago. So it could be a year, 2 years, but that's just how long the federal process takes.
So I'd like to swing the bat again, but if we swing and we miss, is this something that we should consider in the future for a budgetary commitment?
I would say absolutely.
Okay.
Is there a way to
chew on it little by little, or does it need to be all at once?
The problem with upgrading from a 4-inch line to a 5-inch line, if you do it little by little, there's also a cost of appliances and different fittings that we would have to replace on the truck as well, which would be in this grant. Some trucks would be smaller diameter hose, some trucks would be, so it's something that we would like to take a especially the supply line, all at one time.
Okay.
So it's not
Instead of
something we
eating
do.
this elephant one bite at a time,
It is a big.
we
Take a
wanna
big bite.
try- We want to take a
One
big,
big
big
bite.
bite.
But he said
Shark
some of the
bite.
hoses are like 20 years old.
Oh, they're
Some
older
of
than-
that hose
I
is,
mean, that's what I would worry about. How long do they last, you know?
and we're talking the smaller lines as well, like the cross lays, the inch and 3/4 lines, 2.5. Some of that we replaced over the years because it gets used far more than, a supply line. But even some of those cross lays are 20, 25 years old. I mean, we have some old hoses in our department. We try to phase it out little by little and replace it with new, but,
Did they tell you why? Because we applied for this in the past, right? Did they tell you why you get denied, or they just
We've applied one time.
no.
and you just don't get it? You just say you weren't.
Somebody else did a better job. Yeah.
And there are some minimum qualifications with hose, cross lays, the smaller diameter hose would be 7 to 10 years old, I think is what they would consider. But a complete change of LDH, in diameter, because it compares to what we have agencies around us, I think that would be a qualifying factor.
Now, is this going to change like where how you couple the thing into the tanks, or I mean, we're going to have to look at that kind of equipment change and all that stuff.
The appliances and fittings,
It's in the grant.
it's all in the grant, yeah. Yeah. And like I say, right now, Georgetown Fire Department runs 5-inch supply lines. We run a 4. So whenever we show up, we have to obviously adapt that line to their line if we need to use it, which not only Georgetown, but Lexington, different places around use this thing.
Any other questions about that? And Cam, we'll need to have a resolution in support.
Okay.
So if we can navigate that we'll go from there.
Take care of that. All right. Next item I have in this year's budget, one of the capital projects was a storage building behind Station 1. It's a 50 feet by 120-foot building. They actually broke ground on it this week. They're digging holes to go ahead and set their posts. We budgeted $200,000 for this last week.
JR, how many tandem truckloads of dirt did we haul in there?
55.
So thank you to the
Well,
road department.
I was getting there. Without JR and his team, man, this would not be possible at all for us. It would be,
I got more dirt if you need it.
JR, did that dirt come, Chad asked, did that dirt come from the,
Sheriff's office.
Sheriff's office, and we stockpiled down there.
Yeah. I was wondering what all that was doing.
we knew that we would find good use for it.
it came in handy, I will say that it did.
Go ahead, Chief.
But one of the things in our budget for that capital project, we budgeted $200,000, I think is what it was. The actual bid itself came in ran at $207,000. We realized that we'd have to bring some money out of our budget this year to make up that $7,000. But we cut some items out of the original bid to try to come in the budget. So one of the things we cut was the insulation in the walls. So we looked, and we actually we're doing fairly well in our uniforms and PPE budget this year, the line item. So we wanted to propose to the fiscal court to maybe take $20,000 out of the uniforms and PPE budget, bring it over to the special projects budget, so we can insulate the walls in this building while they're building the building, essentially.
And essentially, those walls would be insulated and then a metal
put over.
Metal sheet put over it.
Yeah.
And the package already included insulation in the roof.
The package included, the original bid included the insulation in the roof. We cut the insulation out of the walls to come in the budget. Again, like I say, this would try to get all this done at the same time.
Foam or?
No, it's bad insulation with a piece of metal over it. Basically is what it is. When you look, you will not see the insulation. It'll be a piece of metal over it.
Foam's probably more expensive, I bet,
Yeah.
to blow in.
I'd rather see it foam though.
Yeah.
It'll last longer.
And
You won't have any mess?
We can absolutely look into that.
Is there?
Do we have to do anything, or can they just move that money?
We could just move it, but on something like this, I like to.
We appreciate that.
I like to just put it all out
That'll be
there.
included
We
in the
have
budget transfers that you see at every court meeting.
Thank you,
There we go.
great treasurer. But before we just did that, and like that, just what you said, like they're trying to do BAT
Yeah.
because they feel like, hey, it's going to address the need and maybe be the most economical, but is the spray foam going to last longer? And if you all want them to get an estimate for spray foam, and then we can share that.
And we've talked both options, but after talking to the Tri-County Pole Barns, who's actually putting the building in, their suggestion was just go ahead and put the bat up with the metal behind it. But we will absolutely explore the spray.
I would like to see the difference in the cost, but.
And one other thing in that building, just keep the court
Man, it's coming
updated.
down.
One of the things that we cut
I
out.
foamed my garage, and between the two, it made sense to foam it.
Well, we can certainly get a price.
Yeah, it's worth it.
One of the other things on this building that we actually cut out was getting it wired for electric. Last year, we came to you with our training facility, and we're going to put a fence around our training facility. After talking to Joe Pat and looking at a couple, we figured we may cut that fence out because the training facility actually looks fairly decent from the road. We painted everything. It looks fairly good.
Y'all are doing a great job of keeping your house clean.
It's coming along, yeah.
Respect that greatly, and I still might. We still might put something decorative up there. Not, and when I say decorative, that front corner. In my opinion, you don't need a fence all the way around the thing, but something that lets people know, hey, this is Scott County Fire, but also maybe gives a little barrier. We can talk about that, but you're trying to be good stewards of dollars, and we appreciate that.
Well, like I said, we've talked to Rick a couple times, just looking to get some ideas of how we could do it, and we think $30,000 will get us a long way at getting electric in that building. And we're trying to get as much done in that building this fiscal year, so we don't have to come back next fiscal year and say, hey, we'd like,
So right now, it currently has no service whatsoever electric-wise, right?
There's a service to the building beside it, which the question would be, can we kind of piggyback off that service and go to the
Can
new
you
building?
junction it over or whatever?
So Tyler Wilson, I've reached out to Tyler. I've not been able to connect the dot, but I'm going to ask Shroud Tate Wilson come look if we can just bury an extension from that one garage over to this.
You just open the windows, run an extension cord from one to the other.
Yeah.
And then that's like free. I mean, there's no.
We get a large
We might
fan,
have
we
to
get-
talk about that, Mr. Pratt.
And again, we will be parking trucks out there. You know, some of these trucks are going to have water on them. It's a fire truck.
But also, so you'd move that money out of that fencing to electrical,
For electric, yeah.
and we talked about trying to put some LED.
So I
You
did
got any
talk-
extra LED laying around anywhere?
in my pocket here.
All right.
I did talk to Chief Baker and Chief Ward, and just looked at the situation. It would really be good to get Tyler's, Mr. Wilson's view on it.
Yeah.
They do have a piece of equipment that they want to move out there that we looked at last, and it's hooked up to a 125 amp service right now, but that thing is a new piece and it's not wired that way. So, but he would know how to look at all that.
All right.
And here's one of the just a couple things, and Tyler will know this as well. But the transformers, 300 or 400 feet away. I'm just guessing. Under 2 driveways, it'd be a major expense just to get a new meter service in. The existing building, it's going to be 10 feet from the new building, something like that, and there's the existing services right there, and so, in my view, it's big enough, and we could piggyback off of it. But that's just an uneducated, non-engineer guy.
But you've got a lot of experience with Freddie Kilowatt.
But there's quite a bit of expense just to get a new meter base in.
Yeah.
If Tyler never said that's what you had to do.
We'll try to get him down to look at it.
And which, again, we still have some PPE and uniforms to buy, which we're not going to try to drain that line out in any way, shape, or form. But if we have that extra money, it would make sense to me to go ahead and do that while they're building it and get it in this fiscal year and not have to worry about trying to get it done next year.
Yeah, you definitely want to put your electric in before you foam it.
Yeah. Oh, yeah. So we're working on it.
All right.
Just give you an update on the sale of Engine 11 and run something by the court here. Cortez Island Fire Department had a bid out for engine. They built their bid around Engine 11. That closed today. I spoke to their chief yesterday. As of yesterday, they had no other bids. We were the only on the bid on their truck. They actually had a couple of questions about maybe taking it to either Bluegrass International or somewhere to actually inspect the truck. That way they could get the thumbs up from somebody certified to tell them yes or no, it's in good shape. And then they're going to go ahead and start the process. So we are on the final stretch of getting that truck sold.
That truck's mechanically sound.
It is mechanically sound, Joe. Yeah, it's in good shape. After talking to the judge the other day, myself and Chief Ward have looked at this. The ultimate goal is to have 2 brush trucks replaced with the money that we would get from Engine 11. One of the things that we talked about is we have a Tahoe in this year's capital budget to replace the battalion chief on duty to replace their Tahoe because it's pretty well worn out. One thing we thought about is that Battalion Chief Oliver, who's the battalion chief of training, does have a 1-ton Chevrolet truck that meets the exact specifications of what we're looking at for a brush truck. Talking to Bachman Chevrolet, who is on the state contract for buying Chevrolets, Tahoes are they're few and far between. They're hard to find, especially red Tahoes if you're looking for them. But they just had a shipment of 5 red Tahoes. The SSV models come in. We have 1 reserved for our capital projects for this year. We had talked about seeing if it would be possible to go ahead and get 2 of those, source one of those Tahoes to the battalion chief of training and take his truck and put it in as a brush truck. And with that being said, that would be looking at $54,292 that wasn't in the budget this year that we would make up when we sold Engine 11. But talking to the fellow from Bachman, the odds of him having those Tahoes for longer than a month are few and far between. So if we wanted to do that, that would be something we'd have to act on now. But the Chevrolet trucks, he says that they will get some Chevrolet trucks somewhere in July or August that meet the specs of what we're looking at. By the time we get those in, we'll be in the next fiscal year. And by the time you get them outfitted with lights and stripes, we're looking at the end of this year before we get them going.
So you could get 1 brush truck really active now.
Pretty much now, yeah.
If we converted that over to the thought process of getting the Tahoe, they have it on
they have it sitting on
lot,
yeah.
And then we'd place an order. Probably wouldn't get it until the next budget year for the other brush truck.
For the other brush truck, yeah. And
makes sense to me. Comments or questions, and we'd have to come back on Friday
yes.
and approve it, the purchase. But it seems like this is going to go through with the.
Do we have to wait until it does go through?
Well, can you call Bachman and say, Bachman, we're going to vote on this on Friday. Everything sounds supportive. Can you hold this until? And then JR might be able to back you up. And he has some ways that he makes requests.
Some requests, but no, like I say, looking at that as far as timeline to get the truck online. And again, if we get another Tahoe in here, it might be a couple months waiting for LW to get it out through the lights.
But you're moving things along.
We're moving things along.
And you're not asking for extra money.
We're not asking for extra money.
Would you then sell the used Tahoe? Is that what we do? Like the Tahoe that you're replacing? Would we sell that and get some funds from it?
Well, the Tahoe that actually backs that Tahoe up is in far worse shape than the Tahoe we'd be replacing. So we would move that truck into a backup status.
And then sell the other.
And then sell the other. Yeah.
So 2 Tahoes down.
So, does that sound like a plan to bring to y'all? And then we'll get a price on phone, but and then I'll get Tyler Wilson down here to look at the electrical, and then we'll go from there.
Good.
Thank you. Any questions?
Tyler will be here next Friday.
For walkthrough?
Or Thursday.
Thursday? We'll try to get him down here on Thursday then. Any other business that anyone would like to bring to the court, and then any court member have any business?
Yeah, Joe, can you come on up over here for that? In our last meeting, there was a discussion about the distillery and the road. It's Payne's Depot, and that road of when
Frontage Road number 5.
Yeah, when does the city take it over, and when does the county keep that road? And I reached out to Whitley. I don't know if she's touched base with you. I touched base with Judge Covington and Devin Golden for the city. And after that conversation, we felt like we'll kind of give it to you, and maybe you can create a policy, or you may already have a policy on when does a road go from being a county road to being a city road.
Yeah, I mean, we don't have a specific policy other than if any development takes place within the urban service boundary, urban development, we require it to be annexed. So if the annexation includes the road, it automatically becomes city street. If it doesn't, then it's really a negotiation, I guess. We don't have a specific policy on who takes over the road, although if the road is providing access, we do require improvements to city standards. So we use the city standard for any potential city development, within the urban service boundary. So you do get into situations where you have city property, that's maybe on sewer or whatever, that's utilizing a county road. I can think of, R&L carriers out there on the bypass, on the
Cherry Blossom Spur.
Yeah, Cherry Blossom Spur, Sims Road. So there's property annexed and it's become city limits, but there's both county and city property on Sims Road. So, yeah, I mean, we could look at a policy. I mean, we'd be willing to adopt any policy the city and the county would agree to.
What I had suggested, and what we talked about is, I guess once you get past like 51% of the linear feet or the part of the road that's being used for city properties, then it should go over to the city. That's just Chad Wallace. That's not anything. I'm deferring to you, really. But that was just the thought that I came up with.
If we did a joint resolution with the city about going forward that spelled out some agreement, would that satisfy the question, so to speak?
Yeah, and that's what
Could it be done like a joint?
Yes, or like y'all could adopt a policy, and then the city and county could both like.
Yeah, I
do a
mean, we could look at it
adopting
and
that.
recommend a policy.
Yeah.
You know, recommend something and take it
Could
both
you-
you and the city council.
could you do that?
Yeah, and then we could both approve it.
We
If
could
you-
do that, and
if
then
you would,
we
that'd
could
be
take
great.
it and it could be amended, once we get feedback
Yeah.
from everybody.
That sounds like a good plan.
Yeah, I just want, since Joe was here, and I've been trying to reach out to Joe, but we can bring it to interlocal, or
Got
we
any
can bring
other
it straight to the bodies. It's fine either way. But that's all I had.
Anything else?
Thank you, Joe.
Mr. Hostetler, did you have something?
Well, not about this. I want to go back to the Bierman property.
And go ahead.
I'm interested in hearing more, because I think it was Chad brought up about the
Bevins.
the Bevins property. That was an issue before I was on the court, but it was discussed because of another property right up the street that's now got a church on it. But they were going to sell that property to, if they could get a zone change, to
At the rental place.
a rental
Sunbelt.
company. Yeah, I think it was Sunbelt. And so that was not a unanimous vote on the court, but it did not pass. Because to me, they did, before I was on the court, they did go around the comprehensive plan and allow Bevins to build. I personally was not against them doing that, but I wasn't on the court then. But I'm just looking at this property because here's the thing that I stated, something similar to this when we looked at that the church property, and it's a church now, and they were looking to sell it to this equipment rental place. Once you change that zone, it's done, right? So it can go back, but the property owner's got to request it, right? But this property's sitting there, and that piece that they're looking for is in behind the cemetery. That's why I asked, can you see it from the road? And I'm actually going to do a drive-by when I leave here. We're kind of trapped them. They can't pick the property up and move it. They can't pick their business up and move it, so to speak, that property. That's always the issue that, for me, I just look at each property and each situation, and in this one, I'm willing to look a little deeper.
But this will have a house right next door to it, right? There's a house right on the other side of it, off of
Plus there's residents on the backside.
Coleman, Ironworks, off of
Ironworks is
So this
right
I
behind
think
it.
this is a little bit different in the fact that there will be a house literally
Not just
that will
one,
share.
there's several.
Yeah, there's several.
Residents.
But if they're gonna, that's why I want to do a drive-by, and if it's not inappropriate, I'm gonna drive into the property, and I'd like to walk and look
So,
at it, but.
If I'm hearing you, and you please tell me if I'm right or wrong, you want to gather a little bit more data.
Yeah.
But then you're not asking us to schedule a hearing yet. You just want to gather a little bit more
If I
data.
want to schedule one, I'll let you know, but no, I do want to go.
And
gather a little
that's why I
data.
asked.
Yes, sir.
Because
Yes,
we
sir.
need to notify.
And it's not comical. I shouldn't laugh because it's serious business. I do want to go look at it for that reason, what you guys have said, because I'm also considering they're talking about a 10-foot privacy fence. And if it's just storage, I mean, it's right beside where they're crushing already. I'd just like to go see it. If that's not inappropriate, Cam, I'm going to do that on my way to Lexington.
Yeah,
No, you can go.
Yeah,
You
so,
can go on the cemetery. I mean,
Well, I can drive back through
Yeah.
there, but then also I may visit the business just to see how it works.
I thought the business idea model is neat, and in my world, it's kind of interesting stuff. So
I think that's what we thought when we approved it, when I was on the plan commission, that it was a use for a property that was already zoned. They were recycling, keeping stuff out of the landfill, which helped a ton. And they're doing a good business. It's obvious they're growing.
Right.
I mean, they need more property. But I'll just say
we're
this.
maybe stuck with the
10-foot
domino effect of what happens.
A 10-foot fence is not going to do anything if you see the pile of
Yeah.
crushed stone they got out there now, which is great for them, but a 10-foot
Do
fence
they,
is really
do
not
they
gonna
see
do
the
it.
pile out there now? That's what I want to go see.
It's taller
I
than
read
the
the
building.
P&Z thing report, the minutes, and you said that only one property owner just called, like nobody showed, like, so there was no property owners that had any issues, or somebody called,
Which I think they do.
is what the minutes said.
Yeah, one person called, but nobody showed up at the hearing.
Okay.
They may have been.
What did the person that called say? Like, what were?
Just asked about what was happening, what was the proposal, to explain, what was involved, what they were asking for, what they were asking to do on the expanded area, just more curiosity.
But none of the property owners said no, were against it.
No, but, maybe they, could have been out of town. I mean, whatever you want to read
You
into
know
that.
why this gentleman wasn't at the hearing? Or are you his attorney?
Yeah, I'm his attorney. You're talking about Mr. Beard?
Yes, sir.
Yeah, they're based out of Evansville.
Uh-huh.
The scheduling they had other things going on, they couldn't make it.
You were there, I assume?
I was at the hearing.
Gotcha, okay.
On their behalf.
Okay.
And then Mr. Winstead, you raised your hand.
I did, but the point I was going to make is what Mr. Pratt already did, is that signs were posted at the property about the meeting, letters were mailed to all the adjoining residences, and an ad was put in the paper, and that nobody came forth with questions against it at the meeting. But I just want to make, he made my point for me, or brought it up.
Anything else?
I agree with Rick. I think more information needs to be gathered because
Well,
2
I will-
acres, not a whole lot. Maybe it's time for them to.
I
look
will
at
say
the
that
spot.
if there's a request to have a hearing, then we'll need to know early next week, and then we would place this on the agenda for the 28th.
But we have to give notice and so forth. So
Well,
that's all we
Right,
need to know.
that's why I was asking about the timeline. and
Yeah.
right
Would that
on.
be different than the public hearing, or our fiscal court meeting would be the public hearing? Or there's a public
We
hearing?
would have a public hearing prior to the physical court meeting,
Okay.
I think that's right.
but it would be the same night, most likely,
So we just do.
like at
public
5:30.
hearing, Stop, fiscal, I'm-
To me, it seems like there's already enough in question that I think we should have the hearing because the applicant has already come before us and asking for a hearing to maybe overturn it. And you've already got questions up here, so to me,
I don't know
I
if
think.
they're
there's-
asking for a hearing, though. I mean, they already kind of did that part.
Well, they're asking for us to overturn the plan zoning.
They're asking for their
But
overturn.
if we're going to have a
So to do
vote,
that, we have to have.
if we have to vote, we have to have a hearing.
Yeah.
But like, so and I've read the statute, and from what I'm understanding what Cam's saying, we have to then identify, if I'm right.
Yeah, you have to hang your hat on
we'd
one
have
of
to
those
defend it.
things.
So
Correct.
I don't understand, what I don't understand then is how, if it doesn't fit in the comp plan, it's not zoned in correctly, and there hasn't been any other changes out there, how we,
Right.
like, what would allow us, and this might be a question for Cam, to,
Because then if you get sued and you can't hang your hat on one of those, you lose.
yeah, like, so what would come before, we can talk, I mean, I don't know, I just, first time I've been part of this, so I just don't understand what
Me too.
can change that we
There's
can
a
be like.
list of things, of criteria of which you can overturn, and I'm sure Cam can get a list of that.
Can you send those back out?
Of what.
I'd be interested in Cam's opinion too, if what they're asking would overturn any of that, because there's a lot of legal.
One of the things they've already, I'm sure they've already done it. Sounds like they've already talked about it. You can go back and look at things that have been done in the area, like Meade. It was done when Bevins was building their place.
Precedent.
So that was contested, same thing. And they had reasons. I don't remember what they were, but I've seen them, but I have to go back and look at that.
And I know one thing, when I was on plan zoning, one of our major things was we wanted to keep that a green belt going out through there.
Yeah.
Didn't want a bunch
Right.
of
That's
industrial out
always
there.
been the planning and
The-
zoning.
The Meade tract of Evans property was unique because it was serving the whole community as far as our ag community. So I think that's one of the reasons it did get approved. But the main goal is to keep that as a nice entry into Georgetown.
And I would speak to, not too far distant, there was a request for possible siting of a transfer station in that area, and the court felt very strongly about that, and we then navigated and put in place a transfer station ordinance to kind of lay out that along the same lines of what Mr. Jones is speaking of. Is that's the entryway, the green, the entryway into the community and such. So
And the property they're already on is already zoned out. There's more properties out there that are zoned. They're not being used in proper zone. Joe can speak more on that if he wants, but I just know there's a lot more out there that could happen, but it's just not happening right now, which that's good. Keeps it green coming in.
And back to the transfer station, the big issue with that I remember was the volume of traffic. They've already got X volume, and they're apparently handling it, and it sounds like they're turning people away, so it's probably not going to increase their volume of traffic. It's just they won't turn as many people away. Maybe I heard that right, or maybe I didn't, but anyhow.
that could be the case. Anything else?
No, I was just going to comment on what Rob kind of said.
Okay.
That the comp plan was to protect, the existing state of, development on that corridor, not to kind of encourage further increases in commercial activity along that corridor. Just kind of keep it as it is. And the sewer extension the line wasn't sized for redevelopment of that whole corridor with commercial or industrial uses. So,
I mean, in all of our planning and zoning committee work, for the comp plan, that green belt has been sacred.
Top priority.
Top priority.
Every time we do it.
So, back to that about the sewage line that came through. I'm pretty sure they did have to upsize that line. They did. I know they wanted to purposely keep it as to the minimum that would handle the trailer park. That's the area that the mobile home parks, the two of them, that was the area that they were trying to serve and clean up that private sewage treatment plant that was a mess, and that's true. But they did have to upsize that line to meet the laws. Yeah. So they did have to upsize that line, and I know the purpose why they wanted to keep it a small line. They wanted to make it where nobody could tap on. I had a problem with that too, by the way. So anyhow,
I would very seriously doubt that this project would have any impact on sewer capacity.
No.
Yeah.
I mean, you're talking probably just a handful of additional users, but it's not in the same frame as a transfer station. But the main thing that comes to my mind is still the comp plan, the corridor, and the desire of the comp plan to keep those corridors, the way they are. So, if there's no other questions or comments, Mr. Hughes.
No, I would speak on behalf of the Beermans. We would love the opportunity to have the public hearing, because I think we could clarify a lot of the issues that you're talking about how it's going to actually clean up the front of the property. And we would encourage you to go out there and see how it is now, because we're going to remove some of that from the front and move it to the back with the side screen.
So along that lines, Mr. Jones, just listening to your comments, Mr. Hausteller, do you want us to go ahead and schedule? I know it's not voting on anything.
No, I think, might as well do it now if we're going
to go ahead and schedule.
To me, to be fair to the applicant, I think that's the fair thing.
No, that's why I'm asking.
You want to do it like 28th at 5:30?
28th at 5:30.
Does that require like the same thing, like notices go out to all the property owners and stuff like that?
Yeah. Is
so.
that correct?
We would encourage that. Yeah, that's nothing we would be against. That's
So we'll do that.
Be appropriate, and then I think how we, again, it's my first time doing this as county attorney, but I think how we did this, like with the Oxford thing, was each side had like 15 minutes. So, like, sir, you could have 15 minutes to give your,
clarifications, like whatever.
And then Mr. Kane can We don't have to use all of it.
But I'm sure that
That's how we did it last time.
I'm sure that
Is that, all right? Does that work for everyone?
But if anybody shows up that wants to speak, that's why we're doing a hearing.
Correct. Yeah.
So, with that said, any other new business or anything, I would ask you if you want to stay. I'm getting ready to swear in a new deputy sheriff, David Hodap. It'll take about 20 seconds.
Couple things real quick.
Yes, sir.
Or a couple questions. The clock tower, any update on that?
Yes. They were supposed to be here. Was it Tuesday, JR? And the weather.
I seen the truck sitting outside the other day. Is the only reason
The winds knocked us out. They're coming back on which day? They're coming back on Tuesday with a crane to measure to precisely measure all the faces.
Has anybody else had any feedback on the Lytle's Fork recreation area? Some people's complained to me about the name. About the name. They'd like to keep it called Skullbuster.
Hey, Justin.
That's a
Well,
historical area.
I've not had anybody complain to me.
So,
I
that's
haven't
what
had
thought.
anybody complain to me, Rob.
Okay.
Now, the trails are still Skullbuster trails at Lytle's
That's
Fork.
what I tried to explain. Okay. Good deal.
Hey, Justin. Can I see you real quick before we leave? You don't have to walk.